The spread of the coronavirus is accelerating in Pakistan. The government estimates that over 50,000 people may be infected by May. But what were the major sources of the outbreak, and how did it spread across the country? On February 26th, Pakistan's first confirmed case was 22-year-old Yahya Jafri at the Al Khan Hospital in Karachi. By March 8th, Pakistan would have 6 more cases, all having traveled to Iran. This is the Iranian holy city of Qom, visited by tens of thousands of Pakistani pilgrims or Zaireen each year. Since early February, it's also been the epicenter of the viral outbreak in the country. From the start of the outbreak in Iran till Pakistan closed its border on February 23rd, around 7,000 Pakistanis had already returned, some infected by the virus. This was the first wave of the outbreak in Pakistan. With the border closed, many returning Pakistanis started gathering in the Iranian border town of Mir Javeh. The government reopened the border 6 days later, but would quarantine anyone who had visited cities affected by the outbreak in Iran. Hundreds returned daily, but quarantine conditions in the remote town of Taftan were far from ideal, and at least 2 protests broke out in the coming days. Eventually, over 4,000 pilgrims were transferred to quarantine facilities in their home provinces. It was here that they started testing positive for the virus. In a facility in Sakhar, 50% of the 302 pilgrims tested were positive. The Sindh government blamed this on the poor isolation in the quarantine facility in Taftan. This was the second wave of the outbreak, and by April 9th, returning Zaireen accounted for 31% of all coronavirus cases in the country. The third wave was Pakistanis returning from other parts of the world, especially Europe and the Middle East. Despite screening at airports, asymptomatic carriers or those in the incubation phase could easily get through. One such case was of Sadat Khan of Manga Mardan, who returned from Umrah on March 9th and held a lunch for some 2,000 people. By the 18th, he tested positive for the virus and passed away the same day. Authorities immediately quarantined Manga village, but dozens began testing positive for the virus. Cases like Sadat Khan's account for 24% of all coronavirus cases in Pakistan. The fourth wave is linked to the annual Tableeghi Jamaat Ijtimah. On March 11th, around 150,000 members of the Jamaat had gathered in Raiwind, Punjab. While the Ijtimah was abruptly cancelled the following day, members from abroad had likely already infected hundreds. The Tableeghis then dispersed and started testing positive in places like Bharakau near Islamabad, Sakhar, Hyderabad, across Punjab and KP, and even as far as Gaza in Palestine. Provincial governments began sealing mosques used by the Jamaat, and Tableeghi Marakis were declared quarantine centers, housing thousands of Tableeghis. By April 9th, 19% of all coronavirus cases in Pakistan were linked to the Raiwind Ijtimah. We are now witnessing a rise in local transmissions of the virus that are traceable to one of these 4 waves. But the concern now is that community transmissions may emerge where the source of infection is unknown and therefore very difficult to contain. Play your part in this pandemic. Don't become a cause for the virus to spread. Stay home, save lives.